Hey guys, it's me, Alex, Turbonetic 777. But I'm here to give you guys my 2 week post-op update. I'm at 3 weeks now. However, I went for my 2 week post-op appointment yesterday. That's all they had, so the appointment is a little behind from my surgery date. But anyways, excuse me. I'm going to start off. I'm so excited to give you guys this information just because things are happening, as you can probably see. But let me give you guys my stats. Starting weight. So this was when I first went to see my surgeon. I was at 335 pounds. My surgery weight, which was June 17th, was 317 pounds. So I lost 18 pounds during my pre-op diet. And now my current weight, they weighed me yesterday and I could not believe it. I was going to pass out. I was going to literally burst into tears. Is 288 pounds. Oh my God! So I lost 29 pounds since I've been discharged from the hospital. So that is a grand total of almost 50 pounds that I have lost so far. Amazing, incredible. So regarding my appointment, I am doing very well. My doctor is extremely pleased with my results, where I'm at, how I'm healing. Yesterday they removed my staples. I had 29 total staples. And for those of you who don't know, my first surgery, which was Friday, June 17th, was laparoscopic. However, Saturday into Sunday, I developed complications. I developed a kink and a leak and all that stuff. So they had to do emergency surgery on Father's Day. And they did old school. So they pretty much sliced me open and fixed the issue. So that left me with 29 staples, along with all the other surgical sites from the initial one. So I was gutted like a fish. I can laugh about it now, because it was tough. My body did not handle surgery well. The second time around, my body started to shut down. I ended up on life support for 2.5 days and in ICU for a total of 5 days, and then up in the regular wing for another couple days before I was discharged. So if things can go wrong with me, I mean, it did. But I can laugh about it now. And, I want to thank you all so much from the bottom of my heart for the prayers, the well wishes, the shout outs. Amy, I love you. Just everybody. Thank you so much. My family and I really appreciate it. This was a very tough time for us. And it was nothing but God who helped me through, along with your prayers to Him. So I really, from the bottom of my heart, want to thank you. My voice is still a little hoarse from everything that I had in my throat, which he said was still normal. I'm just thankful. I'm thankful. So now I get to really reap the fruits or bear the fruits. I don't know. I get to enjoy. Let me just say that, getting all fancy. I can enjoy the what's going on with my body now. I'm still, of course, healing. I got a long ways to go, but I'm making very strong and positive strides to 100%. Right now, I would say I'm about 87% 90% there. So I'm almost there as far as feeling my old self. I'm still getting used to a lot of things. I'm getting used to, drinking with a little stomach. I'm getting used to eating because, exciting, Monday I started my soft foods and pureed food. We kind of combined them into 1 week just because of what happened in the hospital. That threw my little schedule all off. So I am doing pureed and soft foods all in the same week. So I had my very first scrambled egg on Monday, and that was amazing. That egg was just incredible. And it's hilarious to me because, I still, I have a long ways to go, but about a month ago, I can go to the buffet and eat me like 3, 4 full plates, sometimes even 5, with no problems. Okay, you would have thought I was a competitive eater. Now, it's a little toddler-sized portion, and I can't even finish it. I have to walk away for about 30 minutes, 45 minutes, an hour before I go back and eat it and finish it off. It's insane. My mind does not grasp that, though, because whenever I do try to eat something, it's like my old mentality wants to come out and, one of those scarf it up. But I can't. My body's like, you better not. I wish you would. So, I've been very lucky, though. I haven't gotten sick from eating anything. I've had egg. I've had cream of wheat. I had that today for breakfast. It was amazing. I had hummus, cottage cheese, ricotta cheese. I've had applesauce. I've had Jell-O, of course. I've had pureed chicken with hummus. And my body has been amazing, knock on wood, which it better be, because they done put me through so much already. But, excuse me. I've been really doing very well, very well. The only problem that I've had, and it's not really a problem because it happens to all of us, but I've had an increase in acid reflux, which I didn't have problems with it before. So my doctor wanted me to take Pridosec, I think it is, over-the-counter medication. And then he said I should take care of it. So I got to go get me some of those. I've been chewing on Tums, and they seem to help. But he wants me to do Prilosec until everything calms down. Another great news, amazing news. So I was on 3 blood pressure medications for over 8-9 years. In the hospital, the whole time I was there, it was discontinued. And I thought that they were giving me something for blood pressure because my blood pressure was ridiculously low all the time. Well, they were not. And I was very surprised. When I was discharged, the resident doctor that came in, he's like, do not take any of your medications anymore. And I was like, are you sure? And he was like, yes, no, your blood pressure is well within normal. In fact, your blood pressure is on the lower side. And I'm baffled. So this whole time, of course, I've been thinking, because the pills are in my little cabinet, and I'm like, oh gosh, I should have a little monitor to check my blood pressure, but I don't. I plan on getting one, but I don't have one as of right now. But I went to my appointment yesterday, and my blood pressure was still very good. And I asked my surgeon, I said, hey, should I start taking my blood pressure? He said, do not. It doesn't look like you need it anymore. He said, however, we were going to monitor that. And if for whatever reason we see any changes, then we may, have you to go back on that. So that's a humongous step. In fact, that was one of the reasons I decided to do this procedure. was because, again, my weight, but my blood pressure was out of control. And I know that this procedure was designed to help relieve for diabetes and fatty cells within the blood. And it said it can help blood pressure, but my gosh, my blood pressure is on point. And that hasn't been like that in forever. So I'm extremely happy about that. Let's see. My struggles, what I've been kind of struggling with, keeping my fluids. You know, I know we're supposed to do 64, but I've been having a hard time. There have been 2 days that I've hit it. One day I actually passed it. But here lately, I've been doing, 48 to 54, and I feel like I ran out of time. And, I have to work on that. In fact, excuse me. Let me take a sip. I have to get better at that. I get nervous though. I'm in the medical field, dentistry, and when I do procedures, when I assist with procedures, I should say, each procedure is about an hour long, or if it's like a crown or something else, it's about 2.5 hours. So how am I going to stop to get something to drink? We're working and there's no really stopping. So I'm kind of nervous about that. But I guess I'll deal with that when the time comes. But yeah, I've been having a little problems with my liquids, which I know is very important to stay hydrated, and I am trying my best. But I just feel after, I just started doing 4 ounces. And literally, I had to push myself. And the first day that I did 4 ounces, I felt like I was going to throw up. Because it was, and I think I might just have been still a little swollen in there. But it's getting better. I'm able to do 4 ounces. But I'm doing 4 ounces every hour. And I'm going to try and do it every 45 minutes to see if that helps keep me on track. But I've been struggling a little bit. What else? Isopure, yeah, I can't do it. I started strong with Isopure, but I think my taste buds changed a little bit, and even my smells are still very sensitive. I feel like it is starting to wind down some, but I'm still very. Isopure had just a ugh aftertaste. The protein shakes it's incredible. They taste very sweet. So again, everything leaves this aftertaste that I just don't like. And so it's a mental battle that I have, with the shakes and the Isopure. But, other than that, I really am not having any problems. My doctor was very pleased with how I healed, with my, with how, I'm doing. Of course, he said for me to work a little harder on getting more liquids in me and whatnot, and protein. But, he said, the nurse said that it's always hard. So the first 30 months, the first 30 days, because you're healing, you're not going to hit any of your goals. But then month 2, you should start hitting your goals. And then month 3, you should hit it and surpass your goals. So that's what I'm hoping for. I'm only week 3. So it's a work in progress. But so far, they're very happy where I'm at with my weight loss. So far, they're just very pleased. With my workout regimen, my wife and I walk for an hour, sometimes a little over an hour every day, and it's going good. It's going good. So I wanted to share this with you guys. Again, I thank you so much from the bottom of my heart. My family and I thank you. For all your prayers, your well wishes, your thoughts, and just thank you so much. I really love you, and I really thank God for all of you. And this is it, and I'll see you next time. And I'll try to get better with my updates. Just bear with me. Bye. Take care.